In 2015, 17 million people died from cardiovascular disease globally. That's our best estimate. That's one death almost every 2 seconds. And roughly 80% of those occur in developing countries. There's a large potential for cardiovascular disease prevention globally through simple means by quitting smoking, by improving diet and lifestyle, like increasing physical activity. The Lown Scholars Program is hosted by the Harvard T.H. Chan School of Public Health, and the idea is to train a new cadre of people and public health professionals specifically that would help prevent cardiovascular disease in the developing countries.
My name is Bongani Mayosi. I'm a senior scholar in the Lown Cardiovascular Program in the Harvard School of Public Health, and I am the Dean-elect at the University of Cape Town.
I'm the director of the South American Center for Cardiovascular Health.
I am associate professor at the Federal University of São Paulo.
I'm from Argentina and I'm a cardiologist and an epidemiologist.
I am from Turkey. I'm a medical doctor and I did a master's in public health. I've been doing research for 4 years.
The main aim of the program is to prevent cardiovascular disease and improve cardiovascular health in developing countries. And we encourage and insist our scholars do that by attacking the root causes of those problems. And these are usually social, economic, and cultural issues that lie at the heart of the cardiovascular disease epidemic.
It's better we encourage people to change their lifestyle so that they don't get diseases that will lead them to have heart disease.
Main themes of the program in 2016 are cardiovascular health in the urban poor, universal primary health care, health disparities, and psychosocial stress.
My scientific work and research has been concerned about poverty-related heart diseases and the genetics of cardiac problems.
As the criminal violence has emerged as a substantial social problem in Mexico, we have started to investigate whether people who are exposed to violence, either at home or on the street, are at a higher risk for cardiovascular disease and also at a higher risk of having behaviors, lifestyle behaviors that could affect their cardiovascular risk.
I am designing an intervention study for the prevention of diabetes in industrial sector of Eastern Nepal.
I'm part of the chronic disease research group at the University of the West Indies, and our focus is on cardiovascular disease, diabetes, and hypertension. Our work looks at estimating the burden of disease, identifying risk factors, as well as developing interventions that will be helpful to reduce the overall risk of cardiovascular disease. We also work closely with the Ministry of Health in looking at possible health policies and using the data from research to help to guide health policy.
The opportunity for me to work with the Lown program is an exciting one because it is the premier program for the prevention of cardiovascular disease in the world. I will have an opportunity to work with some of the best minds in the world on cardiovascular disease.
I think that with their help we can run our research program in a much better way, much more qualified research and better outcomes, and we can also present the results and report them to the scientific audience and other cardiologists, policymakers in a more efficient way.
My favorite part about the program is the international interaction, to talk about my project with people living in low and middle income countries. We are similar problems, similar health problems, so we can discuss how can we prevent cardiovascular disease in these countries. And I think we can come back to our countries and try to training another generation of epidemiologists. So I think it's very important.
It's very rich to know about other realities and other ways to do things.
The program gives you that opportunity to interact with whoever professor you'd want to interact with, whoever has the interest that you'd have with. Back home, to approach a professor ahead of an institution, you have to go through so many roadblocks. But here, they give you whatever time that they have allocated you, and you chat as, so almost like equal.
The Lown Scholars strive to improve the cardiovascular health in developing countries through combining two major roles. As scientists, they are pioneers in developing new knowledge and really answering the question, how can we prevent cardiovascular disease in each specific setting? But more importantly, as public health professionals, they embody the social responsibility aspect of Professor Lown's work to design programs that help those who are in most need in their communities and in their countries.
The Lown Scholars Program has been very helpful in different aspects, in mentoring, in training, in finance. And I think these are one of the major things that are necessary and that are needed back in Africa. And I've learned a lot in this time. And I think that has made tremendous impact in my career.
Quite grateful to be associated with what is happening here. I've never been to Harvard before. This has given me an opportunity to see people teach cardiovascular disease epidemiology the way I have not seen it taught before. And this will shape most of the designs I'm going to do when I go back to Nigeria in order to do it well, so that my result will be comparable to what is seen in other parts of the world. So it's quite amazing to have for the fellowship to give me an opportunity to come to a very top institution like Harvard. So I'm quite grateful and I'm happy. I'm pleased to be here.